One of the things that I think is important, just sort of following up on that previous comment, that public education, public awareness is critical and central to a national strategy. We have done that with so many other issues. When I look at all the excellent work that was done around educating the public when N1H1 was a threat, just simple things that people can do to prevent that from spreading. There are similar things we can do, simple things that we can educate people on that will make an enormous difference. That's part of the strategy, and that's a role that the federal government can and needs to play in helping to coordinate those efforts and to make sure that every Canadian has that information and knows when to ask about suicide, to know that it's okay to talk about suicide, and to know what to do.
Dale Smith?
I have two questions. First one is more for the other two guests here. There's been a lot of talk in the media lately about gay youth suicide, so I'm wondering if what kind of concrete things that these strategies might talk about in terms of that specific issue.
I think the strategy and the Canadian Association for Suicide Prevention has developed a suicide prevention strategy. It's now about 4 years old, and in that strategy we identify certain at-risk groups. Certainly we've known for years that gay and lesbian youth are at tremendous risk, and that's been painfully demonstrated again in the U.S. over the last few months. So part of a strategy and part of preventing suicide is also addressing issues of homophobia and ensuring that gay and lesbian youth have the support that they need and can live in environments and cultures that support them for who they are. Those things are central to an effective strategy.
I think also that an effective strategy will, in addition to identifying those numbers of individuals who would be in high-risk groups, also need to look at education around the stigma, because oftentimes it is that very large wall of stigma. And if you think of someone who is gay, lesbian, transgendered as a youth, they're going to be running into many walls. And if in fact talking about their suicidal thoughts is a barrier because of the stigma, then they are not going to be taking those very necessary actions to preserve their life. I think the other thing we need to talk about is we sometimes even have trouble saying suicide. And I think even times we have trouble saying death by suicide. And so we need to start to educate the public that this is death and it's suicide. And we need to say those words, as difficult as they are. Coaching a young man recently, he said to me, well, I was talking to my friend, this was before a suicide attempt, I was talking to my friend, and I said to him, are you thinking of checking out? And he didn't understand what I meant. And what I meant to say was, are you thinking of killing yourself by suicide? Are you thinking of taking your life? And he said, I think if I'd said it that way, he may have answered me differently.
As a gay man, I certainly remember the pain as a youth, and even having supportive and loving and caring parents, it was difficult. And I remember going to a guidance counselor. I was struggling I had thoughts of suicide, and going to the guidance counselor to begin to talk to someone about what I was struggling with. And when I told her that I had sometimes thoughts of suicide, her response was, don't be silly. And that conversation didn't go any further. And certainly I don't want any gay or lesbian youth to encounter similar sorts of responses that are devoid of any kind of compassion and understanding.
Megan?
I just want to pick up on something you said at the end, Mr. Wall, about the warning about perhaps suicide rates increasing among the elderly. I'm wondering if you could just elaborate a bit more on why the rates might be a bit higher among the elderly and what sort of issues are associated.
My concern is that the elderly already have a high rate of suicide. The rate of suicide amongst the elderly is just as high as it is for children and youth, but we tend to ignore it. It doesn't get the same kind of attention. Elderly people are often more isolated and have fewer resources available to them. My concern that our population is getting older, and if we don't address this issue, that rate amongst our older citizens could go up. So it's we can't ignore that. We have to be sensitive to that issue.
Is that one of the areas where you spoke about gaps in services? Is that one of the areas? Do you think?
I would say that's an area where there's a gap. It's been overlooked. I think that the Canadian Coalition for Seniors' Mental Health not that long ago did some excellent work around preparing material for healthcare providers, in particular physicians, to help them to identify older patients that could be a risk of suicide, and to know how to begin a conversation with them. So there is there's just been some incredible work that's been done. But again, I go back to my previous point. Not everybody knows about it. One province doesn't know what's going on in the next province. So there has to be mechanisms in place to ensure that all healthcare providers know about what the Canadian Coalition for Seniors' Mental Health has done, has access to that, and can use that to make a difference.
I just want to touch base as well with respect to education. I think that you are absolutely correct with regards to educating, and it's starting to educate people at a fairly young age on this as well, and even for agencies and businesses to know what the signs are. And I'll tell you, I'm bringing this up because just this past year, one of the volunteers in my office committed suicide. And it was quite detrimental to me, that we didn't read the signs. One of my first calls when I was elected was from someone who was threatening suicide. So I think that, we need to have a better education mechanism in place. We need to have, just as businesses have at this point in time, a scenario that if there's a fire, this is what you do, or how do you handle certain situations. I think that suicide has to be part of that strategy as well.
And I think you bring up a good point, because in our workplaces is a wonderful opportunity, because there, again, are human people with human problems and opportunities to save a life.
Dale?
Just for the MPs, where does this bill look like it's going to be on the order of precedence?
The million-dollar question. As far as the order of precedence, it's pretty low. But like I said earlier, if the government said, please pull this bill, you can't have two bills on the same issue, please pull this bill because we want to enact it, hallelujah, I would pull it in a heartbeat. If government said, in fact, we're going to make this a part of the mandate of the Mental Health Commission, wonderful, I will pull it. If government says, this is actually about public health and we want it to be a part of the Public Health Agency, I would pull it. This is not about this bill. What this is for me is about preventing suicide in Canada. So it's low, but I would happily pass it over to a member of government, to a member of the Liberal Party or the Bloc Québécois who want to introduce it, and they would have my full support.
Oui, peut-être que le projet de loi n'est pas en ordre pour être passé immédiatement, mais je crois que c'est urgent. Et puis, il faut vraiment avoir quelqu'un qui est prêt à prendre la relève. Comme vous le savez, des projets de loi sont déposés, c'est des idées qui sont déposées pour donner la chance au gouvernement d'y penser et à d'autres collègues aussi à y penser. Alors,
comme que Megan elle a dit, si quelqu'un est prêt à prendre la relève et s'assurer que ce projet de loi pourrait être avancé encore plus particulièrement en direction urgente, alors c'est certain qu'on serait prêt à enlever le projet de loi de la ligne de process.
Yeah, look at, when you say it's urgent, look at the It Gets Better campaign, right? The It Gets Better campaign is this instantaneous flash of community support, community action, reaction to GLBT youth who committed suicide. And it's this incredible grassroots response. And it's there because there is no leadership on this issue, because there is nothing to grab onto and say, yeah, we support that, that's what we want. There's this total void. Again, it's not gaps. We're not talking about gaps. We're talking about giant chasms. And the It Gets Better campaign is a wonderful campaign, but it has been born out of the fact that we are not acting on this issue. It's beyond urgent.
Et entre-temps, il y a des stratégies qui peuvent mettre en place, que si ce n'est pas tous les points du projet de loi qui est déposé, entre-temps, il y a des stratégies qui peuvent être mises en place et puis qui pourraient sauver des vies.
Any other questions?
Merci. Thank you.
Thank you.
Thank you.
Merci.